countries such as Angola, Botswana, Bhutan, Gabon, Guyana, and Mozambique, we've been investing in programs that have contributed to decriminalization that's happened in those countries. We do this by making investments in LGBTIQ organizations to support community empowerment, community system strengthening, and advancing specific human rights related programs embedded within disease programs or health programs. Examples of this might be in supporting an LGBTIQ organization that is helping to reach populations for a health intervention, but in order to do that, you need to ensure that this organization is sustained and has paid staff and volunteers that are supported, but also in ensuring that they're able to procure safe spaces so that peers are able to come together. And whilst our entry point is HIV, TB, and malaria, actually we need to speak to holistic needs of individuals, of people, of LGBTIQ people, which includes elements of socializing, perhaps economic empowerment, as well as health, and also in the agenda to assert their health and broader human rights in country. For instance, in Botswana, the Global Fund invested in a number of actors, including Banela Legabibo and the Rainbow Identity Association, who ran programs to sensitize traditional leaders, religious leaders, politicians, and really importantly, the general population. If you look at what Florin was saying in terms of attitudes, across much of sub-Saharan Africa, well over 95% of the population still have hostile views towards LGBTIQ people. And so there is a significant journey to be done. However, in Botswana, amongst many other actors, work on sensitization, legal literacy, was enabled successful challenge to the laws in the country, and through strategic litigation, LGBTIQ relationships were decriminalized in the country. Now, that mustn't be recognized as anything to do with the Global Fund, but it's our contribution to those activists and LGBTQI actors and allies in country who face the daily risks and challenges and for asserting their rights. Another example of how we support would be Mozambique, who also updated their penal code and decriminalized in 2015. However, attitudes of healthcare workers, of decision makers, of politicians are still not always receptive or accepting of LGBTQI people, plus many other laws and policies remain that continue to need to have action on, and really support work to address national strategies, including HIV and health strategies, but other strategies in terms of education and championing comprehensive sexuality education, for example, continuing to support legal programs and access to paralegals, so that when people do have their rights infringed on or violated, or the government fails to protect or promote their rights, we can take we can support them to take action on it. So I think that there's a significant journey around leveraging the health angle. What's really interesting is that the archaic colonial legislation that exists in many countries, which penalizes LGBTI rights, or often sex between men most frequently, that is used to also attack other people who have different sexual or gender expressions, is counterbalanced by, in most constitutions, a right to access health for all. And so that's a very good entry point in being able to make an argument. In order for someone to be able to access health, they need to have a sense of self, and to have efficacy and self-efficacy to be able to engage in services and enjoy them. And then perhaps just going back onto the other side, I've lived in South Africa for a very long time, and in South Africa, LGBTIQ rights are enshrined in the constitution, thanks to the government of Nelson Mandela. However, the country suffers huge amounts of violence to LGBTQI people, and particularly to lesbian, gay, and bisexual women. And this often happens with impunity. So the laws is one thing, but being able to hold decision makers and duty bearers accountable to those laws and to make sure that populations respect those laws is another thing. Let me pause there.
Thank you, Gavin. Yes, lots of food for thought here. We'll turn to the last speaker before we give the audience a chance to ask some questions. Norway has been one of the, or health has been one of the main development assistance themes of Norwegian development aid, and I think it's the biggest chapter that we have in our assistance. To what extent does this massive amount of money also contribute to improvement in laws or practices or less discrimination in the work? What areas do you have where Norway contributes?
That's a very specific question. So, but I'll just say, I mean, Claire and Florin, I think it's important. I mean, we've got obviously in the larger picture, showing a Norwegian picture, around to celebrate 50 years that, I mean, we passed that. I mean, I was born in 1966, so I mean, it's within my lifetime. I think it doesn't take many years before, I mean, new generations come up and we forget how bad it is, how bad it was. And I think also your testimonies here, I mean, show that it's really, I mean, this is hurtful and it's happening around us. And I also think it's an opportunity for people like myself to come out of offices, government offices, but also other kind of offices. And it's clear when we see the Norwegian, shall we say, celebrations now, that we also know that, I mean, flags are being taken down from schools all over Norway. So I mean, just saying to you, it's great you're here, and it's your testimony is also, shall we say, a powerful reminder that things risk slipping back. And perhaps that's one of the main, shall we say, my key points, my key takeaways today. That there is a decline in democracy in many places, and it's also, shall we say, a decline, a pushback on human rights overall. So I mean, it's this sexual rights are perhaps those rights which are, shall we say, the easiest to push back from, shall we say, totalitarian government side and so on, and also, I mean, within many societies. So I mean, it's really, I think, also important to see this as what they are, human rights threats overall, and it's a symptom of society and how it evolves or slides back. To your question, or Tor in English, I think that's great. That sounds powerful. So Norway has very clearly had global health as a priority for 20-25 years, and at least, I mean, longer than that, but in particular with huge budget investments, and also was one of those led to establishment of the Global Fund to fight HIV and malaria, very clearly UNAIDS, but also many civil society organizations. I think in terms of public health, I think my second key message, the first one being we need to push on, is that the health sector, medical professionals can do a huge difference, both in a good way. I think this is what we're also discussing today, but also in a bad way. And Claire, your example is very clear of this. So I mean, the health sector as a gatekeeper is very important. And at the same time, we should not reduce this to an issue of disease or medical conditions, the health sector. It was right when the HIV/AIDS crisis came up to make this a whole of society approach. We see this also with COVID, the pandemic, that it goes to head of state level. And then it's clear the health sector has a huge role to play, both for good and for bad. I mean, we see health ministers play a very, very important role in terms of being able, shall we say, to navigate the sometimes complex political realities in countries. And they can make a huge difference. he or she, can do a huge difference in a positive way, but also in a negative way. So I just would like to stress that there's a huge big responsibility on the health and medical side to be a proactive, constructive, shall we say, stakeholder and advocate here. Often we see that the medical profession at highest level have very good connections with governments, with private sector. They have access to the highest echelons in society. So it also provides opportunities to shall we say, in an astute way of setting standards and being a role model. So why public health? Why is it important to think about it in terms of human rights? I think, Gavin, the Global Fund is not only a health organization, a health global fund, it is a human rights, shall we say, actor. It is also one of the largest investments we see where it makes a difference in so many countries. I know there are big discussions in terms of when can countries graduate, meaning step away from getting, because they have achieved a level of economic development where they don't need the global funding anymore. And it's a very hard issue, because we see even the countries develop, get to, shall we say, high economic level, human rights do not necessarily follow that. So these are important issues to be aware of. Public health, why is public health important? It allows basically a response not only at the individual level, shall we say, so in particular when it comes to groups of people which are decriminalized or which are criminalized, where there is stigma, that basically can be in prison without any, but it allows to look at a group of individuals collectively and also approach a discussion. That's why the health ministry is so important, but also in court. And instead of making this, shall we say, an issue which have to do with separate individuals, to basically elevate this at a population level. And then it is possible to go in and argue for, okay, this part of the population has rights, definitely. I think it's important to push for that. But also there are vulnerabilities, risk for the whole population, because, for example, there might be a high level of risk, a high level of, in the case of HIV, as one example, but we can say TB, we can say that there is a high risk for the population at large of, shall we say, a growing epidemic or negative issues, negative effects, if one doesn't address the risk factors and actually open up for interventions with that part of the population. I think, for example, people in jails, very good examples, so that one basically highlights a group of people that one can then address in court as part of health legislation. I think insurance is very important. More and more countries have insurance schemes, and it's so easy for, shall we say, for insurers basically not to include. So I think I'll stop there. I'd like to come back to some of these issues, but your question, what does Norway do? I mentioned the Global Fund, or Gavin mentioned the Global Fund. It's very clear that civil society organizations play an extremely important role. We are very proud that we were one of the, shall we say, those that launched the Robert Carr Foundation, that works with and supports networks at regional level in particular, and inter-regional level, of interest parties, interest groups that represent key populations. And we have some example of that, how important it is to have safe spaces, learning spaces, supporting actions which needs to happen at local level. And then UNAIDS, I think I just would like to raise UNAIDS as one agency, an agency that works across UN agencies, both in terms of the work that is being done in country, but also at international level. It does matter what the UN, what member states decide or not decide. And again, here we see a huge pushback. WHO is getting to be grounds of comebacks are increasing every day. So back to you for now.
Thank you. Thank you to you, Paul, and all four of you. I think there has been a number of different issues that have been raised here, so I will not make any attempt of summarizing. But maybe some of them have been more interesting for any of you in the audience. So feel free to take the floor. I can see someone here. We have someone helping with the microphone. Yeah, there you are. Yeah, so go ahead.
Yeah.
State your name and...
Hey, my name is Paul Omer, and I've written down a little summary of a little prologue and then a question. Florin mentioned how they in Romania, or that coalition you talked about, basically use the whole protect the children shtick to try to discriminalize LGBT community. And I want to quickly mention a queer theory and ask a follow-up question regarding to that. Reid coined the term reproductive futurism in his book No Future. Central to the theory was the figure of the child. Said in a more concise way, parents has a vision for the child's future, and in that, and how they think they ought to be as a person. That usually means a future where they're married with children. And they use that whole perspective to take away human rights from adult LGBT community people. So here comes my question. Do you think a traditional view of marriage and family, or in other words, heteronormativity, might be the drive of this kind of ideology? And how can the health perspective counter that ideology?
Thank you very much. I don't know who will want to reply to this. Florin, you were mentioned.
I can try at least, but I will, in the same time, I will avoid any reference to queer theories on purpose, and will try to be as realistic as possible in my local, national, and regional context. Probably in response to the queer theories that were developing in universities at the beginning in the United States, the anti-equality opposition has came up with a different term called gender ideology, which is putting together under the same umbrella sexual orientation, gender expression, gender identity, anything connected with gender. So anything connected with gender became a big problematic issues in some of our European regions, to the point that gender is considered to be highly problematic and should be not just contested in the university space, but actually prohibited from teaching, but also from displaying in the public space. And that's the problem with this type of, let's say, attempt to rewrite the human rights architecture in terms of gender equality. We will introduce censorship in the public space if we allow this type of reinterpretation of what gender is. So it's a conceptual battle, but it's also a human rights battle about our lives, our experiences, about how we define ourselves in the society, and how we should preserve our space in this society for living, for expressing ourselves. So at this point, this gender ideology battle is involving churches, is involving a significant number of organizations, but also governments. When you see that the previous Bulgarian government actually decided to leave Istanbul Convention because of what gender is considered by some of these politicians, you realize that's a huge issue, a huge problem. When you see attempts of various Romanian politicians to exercise pressure upon government to disconnect from the Istanbul Convention, you realize that it's a whole political battle that can influence our lives for the next 10 or 20 years. So it should not be taken, it should be taken seriously. And when I'm saying that, I think we should also involve these international organizations to defend some red lines. You cannot cross some red lines. And unfortunately, these red lines are frequently crossed in some of our countries. And I'll give you an example. I'm sorry that I'm using Global Fund rapidly as an example. When Global Fund is leaving, there is no mechanism of enforcement upon the national government that signed the contract to respect its obligations. In our case, that means that the government can allocate no money for HIV/AIDS prevention, can allocate no money for sexuality education, can do whatever they want in terms of the human rights legislation, and that's wrong because the governments had to respect some legal-based obligations, and the Global Fund has no power, at least so far, to exercise pressure upon this governments to actually respect its own written obligation. I would say that this gender theory is the battle of our lives, and what you are experimented here in Norway and in other countries in the region will have a huge influence in our Eastern European countries. That's why we had to forge new connections with you guys to defeat these forces that try to deprive people from their human rights.
I think we need to have short questions and short answers. So we'll go to the back there.
Hello, thank you for these very interesting discussions. My name is Laila Lekti. I just want to ask, because you were talking about the international community, and we know that I want to ask a Global Fund and NORAD. Now that we experience cuts in international development and we have the war in Ukraine and the COVID pandemic, do you think this will affect how you work on LGBTI issues internationally going forward? And also what Claire was mentioning about conditioning the support, is that something that you are considering? Thank you.
I guess that is to Gavin and maybe Paul will start.
So I can start here. I mean, if State Secretary Sancha had been here, she would have said definitely the policy, I mean, human rights and LGBTIQ plus people, the rights of LGBTIQ plus people will remain the same. I mean, they are, and for those in particular interested in Norwegian political, I mean, there are two ministers in the Ministry of Foreign Affairs, and both ministers are very clear on this as priorities. So the political, shall we say, ownership is very clearly there. To your question, are we seeing a change in how ODA or aid flows and so on is basically working, levels and so on? Definitely yes. I mean, but there are many reasons for this. I mean, Ukraine very clearly is a tragedy, and we see this in this year's, next year's budgets. There will also probably be a reconstruction on Ukraine. I mean, so all of this will be important priorities in Europe and for many actors. But I mean, there are many crises at play here. So it's very clear that that's also stated priority. We will increase also on the Norwegian side investments in climate and nature. And we also sadly see that humanitarian, shall we say, situations are increasing. So we can say that we'll see what the Norwegian MG, this is a very Norwegian discussion. Our ODA is linked to the GNI, I mean, to how the country is doing economically speaking. It's going fine now, but I mean, we shouldn't shy away from seeing that it's perhaps not going to be as shall we say, plain sailing in the years ahead, and very clearly there's a political debate. So I think my general issue would be, it would be even more important, shall we say, to have clear priorities, but also look at the effectiveness of funding. And my last point here, I think the issues we are discussing here in terms of gay rights, in terms of discrimination legislation and on democracy are not only, shall we say, areas which are pertinent to the development cooperation side. These are global issues. So exactly how we work, and I think also in terms of working networks and so on, it goes far beyond. I think we have a lot to contribute and a responsibility on the development cooperation, international assistance side, but it goes far beyond. So I think we need to think in very new ways.
Do you want to add something, Gavin?
Yeah, I'll try and speak quickly and be concise. So, you know, I'm really conscious that, you know, these investments are not short-term investments that are needed, they're long-term investments. I, like Paul, I was born in 65. I grew up with Section 28, which was a law banning any communication around LGBT in schools. There's currently debate in the UK about trans kids growing up, and it's these same issues and narratives. In terms of the Global Fund is currently in replenishment, where we're seeking a 30% increase in the funding. And we're really determined that we must deal with AIDS, TB and malaria as epidemics. If we can't do that, we can't move on to other aspects of the health development agenda. It's simply too much of a, it'll be